Hello there, the big debate that continues to rage in the country. Should you have a lifting of the lockdown after the 3rd of May or should you not? Now, the people who are saying that you have to have at least a phased relaxation of the lockdown are making a very simple point. The vaccine is maybe 12 months away or maybe longer. A cure is some distance away. You can't really keep 1.3 billion people locked down for months and months and months. It's simply not sustainable. The economy will collapse completely. The other side, the flip side of that is, yes, but when you relax the lockdown, and if you relax the lockdown, cases will start to rise. And that is, by the way, true to some extent. However, what many experts are saying is the number of cases by themselves aren't all that you should be worrying about. Cases can rise, cases will rise. At some point, that's what the logic of herd immunity and theories like that are. What really matters, and that's the reason why we had lockdown number 1, 40 days of lockdown. Number 1, you should control the rate of growth of the cases. B, you should build up your healthcare and your health infrastructure so that you can deal with the cases that are coming in. And number 3, you should have some sort of control over the death rate, the number of people who are actually dying. Now, on all these fronts, let's see how India is doing. Thanks to the lockdown and thanks to the other efforts that have been made, we are seeing an increase in cases, but the rate of growth is under control, 6% or thereon, and it's a linear growth. It's not exponential. When it comes to capabilities, we've built up massive testing capabilities. Beds are available, 2 lakh isolation beds, most of them, 90% of them empty. Only 10 ventilators, for example, being used right now. So healthcare capability has been built up to some extent. And then when it comes to death, hey, just look at the numbers that we are seeing right now. 70% of all deaths in India are coming from just 3 states, Maharashtra, Gujarat, and Madhya Pradesh. If you add Delhi and Rajasthan to that list, 80% of all deaths are coming from just these states. In the rest of the country, there are barely 200 deaths. In the rest of the country, just 200 deaths. So, obviously, the logic and the numbers seem to be pointing to some sort of a phased relaxation, and that's probably what the government is contemplating. And what would this presumably look like? It would say, in all the really bad areas, the red zones, keep some sort of restrictions on. In other areas, progressively relax it. But when you are relaxing restrictions in green zones or amber zones, you've got to keep testing. That's where the capacity of 50,000 testing really kicks in. You've got to keep testing, and the minute you see cases somewhere, you've got to crack down on it. And if the situation gets out of hand, well, reassess. That's at least what the theory is saying. Let's see what the government does.
The Punjab government on Wednesday extended the curfew in the state by 2 more weeks beyond the national lockdown in place till May 3rd to curb the spread of coronavirus disease. Chief Minister Captain Amrinder Singh made the announcement during a video address and said the curfew will be lifted for 4 hours every day to allow people to step out of their homes and shops to open. The state's Information and Public Relations Department issued a guideline for shops to open in a staggered manner across the state from 7 a.m. to 11 a.m. The guideline said people must strictly follow norms on social distancing, use sanitizers and masks.
Central teams that had been set the task of checking preparedness of districts with a high load of cases have found that correct protocols were not being followed in several state hospitals. This comes at a time when several frontline healthcare workers have been infected by COVID-19. The team set up by the Union Health Ministry also observed that the temperature at which samples need to be stored is not being strictly adhered to, leading to the possibility of incorrect results, and that many healthcare workers were unaware of guidelines to be followed in handling a COVID-19 patient. The central teams, which had been reviewing the state hospitals for their preparedness against the COVID-19 pandemic, have given a levy of recommendations. Among the recommendations are the creation of separate areas for mild, moderate and severe cases within hospitals, training of healthcare workers in clinical management of cases as per the national clinical guidelines, and for labs to follow laid down procedures of sample collection and transportation. They have also recommended deploying more field staff for house-to-house survey in containment zones and strengthening of passive surveillance in buffer zones to scope out asymptomatic cases.
Adding another chapter to the BJP versus Mamta saga in Bengal, BJP's Bengal in charge Kailash Vijayvargiya has shot off a 6-page letter to Chief Minister Mamta Banerjee accusing her of misrepresenting the number of COVID-19 deaths in the state. Labeling her attitude towards the centre and the governor as confrontationist, the senior BJP leader said that the TMC chief's behaviour is making the situation in Bengal worse. Accusing her of abject failure, Vijayvargiya claimed that the day West Bengal announced 18 deaths in the state, her own officials told the central team that the real count was 57. He also called Bengal's testing rate shamefully inadequate.
Finance Minister Nirmala Sitharaman on Tuesday accused Congress leader Rahul Gandhi of misleading the people in a brazen manner and sensationalizing facts in the willful defaulters issue. In a series of tweets, she said that between 2009 and 10 and 2013 and 14, scheduled commercial banks had written off 1.45 lakh crore rupees. She said provisions are made for non-performing assets and upon full provisioning being done, banks write off the fully provided NPA but continue to pursue recovery against the borrower. No loan is waived off, she wrote. The finance minister said they are those well-connected promoters who benefited from UPS phone banking. She then recalled the words of Raghuram Rajan, who said a large number of bad loans originated in the period of 2006 and 2008. Too many loans were made to well-connected promoters who have a history of defaulting on their loans.
The Kerala government has decided to bring in an ordinance to cut its staff salaries in the wake of the COVID-19 crisis. The move comes after the High Court stopped the government from cutting salaries. The government has decided to cut 6 days' salaries of government employees in a month for the period of 5 months starting from April to August to fund the anti-COVID programs.
Senior Congress leader P. Chidambaram on Wednesday urged the government to announce a scheme to protect the salaries and wages of 12 crore people as employers are facing a financial crunch in the wake of the COVID-19 induced lockdown. Chidambaram proposed the Paycheck Protection Program of the United States. He also called upon the government to announce a financial package for the MSME sector as proposed by his party and provide financial assistance to states to fight the novel coronavirus pandemic.
Over 2 lakh H-1B visa holders could lose their right to be in the United States by the end of June, according to a Bloomberg report. Jeremy Neufeld, an immigration policy analyst, told Bloomberg that 250,000 foreign workers seeking a US green card, of which 2 lakh are H-1B visa holders, may be forced to return. He also said thousands more who are not seeking resident status may face the same situation. H-1B is a non-immigrant visa granted to people with specialized skills who need to be employed by US companies. Though US has decided to grant extension to people whose visa is due to expire soon and couldn't renew it because of the pandemic, many H-1B holders have either lost their jobs or are on leave without pay. According to the visa rules, a H-1B holder cannot legally stay in the US for more than 60 days if they have been terminated from the job or without being paid.
The Karnataka government on Tuesday permitted IT companies to continue working from home till July end. This came as the state announced easing of restrictions in some parts that have not been heavily impacted by COVID-19.
The ongoing lockdown could lead to 7 million unwanted pregnancies due to disrupted access to contraceptives for 47 million women in low and middle income countries, shares a new report by the United Nations Population Fund. The study indicates that about 450 million women across 114 low and middle income countries use contraceptives. Lockdown-related disruptions will also cause delays in programs that discourage child marriage and female genital mutilation, and this may lead to an estimated 13 million child marriages in the next 10 years. These alarming projections are only estimates assessed in collaboration with Johns Hopkins University and Australia's Victoria University.